Hello, I am Dr. Tshepiso Mfolo and I'm the founder of Smile for Two Mom. Today I just want to talk to you about a very important topic that is close to my heart, preventing early childhood caries. So this topic is about preventing decay in young children. It's very important that children are introduced to dentistry at an early age, as early as the mother taking care of their oral health during pregnancy. So early childhood caries affects around 530 million people globally, and this disease also affects a lot of people in developing countries like South Africa. So it's very important that we have a preventative approach than a restorative approach. There has been a paradigm shift that we need to prevent the disease than treating the disease. So that's why the importance of oral health during pregnancy plays a paramount role. So early childhood caries affects the child's quality of life. When the child has decay, it's more than just having a toothache. It affects their quality of life in that they cannot sleep. A child with a toothache cannot sleep. A child with a toothache misses school. A child with a toothache has problems later with speech because they are going to remove the teeth prematurely. A child with tooth decay has got a lot of pain. So it's very, very important that we intervene quite early. And you know, as a dentist, we see these children quite late. So parents bring their children quite late to us, and it's very important that the mothers and the fathers establish a dental home for the children before the age of 1. Yes, I said it. Before the age of 1, it's very important to bring your little one to the dentist. So what we do in those visits, it's more like a chat and also sensitizing the children to our environment as well. It's also checking inside of the mouth, building rapport with you in terms of breastfeeding. Are the children latching correctly to the nipple? Are they feeding correctly? Because children might have something we call a tongue tie, and that is diagnosed on our dental chair, and then we have a collaborative approach with other maternal health facilities. So that's why it's very important that you bring them before 1, and also we check inside the mouth. You know, we are encouraging also the nasal breathing. Breastfeeding is also important in terms of the facial growth. So there are so many things that we also look at. We also speak to you about, you know, the transferring of the bacteria in the mouth. So what happens is that when the mother, the primary health caregiver, has a high level of bacteria, we call it the Streptococcus mutans. When you have a high level of that Streptococcus mutant and you kiss the baby or you lick the dummy if it falls, or sharing of the utensils, that saliva is used as a vehicle to travel from the mother to the child, and it makes the child being prone to dental decay. So it's quite important that mothers are also equipped with that knowledge. If they know better, they will definitely do better. And this early childhood caries is also very important that we intervene quite early, because sometimes you find ourselves having children that come for general anesthesia. They have to be treated under general anesthesia because it is so difficult for them to cooperate on our dental chair, and general anesthesia is quite expensive. So dental treatment is not expensive. Neglect is very expensive, and the children tend not to want to come to us. You'll hear words like, we don't like going to the dentist, we hate the dentist. But if you bring a child quite early, and we can remedy that type of a thought. You prevent the disease from happening. Also, this early childhood caries affects the economy, because the mom or the dad has to take away, days from work to come and bring the child to the dental facility to be treated. So it's quite important that the parents also make sure that they bring the child quite early, so that we can avoid multiple visits to the dentist. So the message that I would like to bring forth is that early visits to the dentist are really will be helpful and will yield a better oral health and a better general health for the child and also for the parents.